With genetics and cardiology, sometimes people come in for testing because there's something structurally different about their heart they were born with and trying to figure out if there's a reason why. And then other times they may have a diagnosis of something like a cardiomyopathy or a dilated aorta or something like that that kind of raises a suspicion for an underlying genetic cause for that. And also sometimes there can be a family history that brings people in if they know that there's a lot of their relatives who had cardiomyopathies or perhaps passed away from younger ages from cardiac events, arrhythmias, some of those kinds of things. I would say compared to where we're at with what we can do with genetic testing in the cancer world, we're still a little bit more in some of the learning phase with cardiology, but it's come a long way pretty over the last couple years there. And so if something is found that indicates some sort of genetic component for a cardiac condition, it's pretty dependent on, again, what specifically is found. Sometimes there can be very specific management recommendations of, we found this change, it's associated with a risk factor for this is what you need to do next. Sometimes it's a matter of, we know there's a risk for this, and if you haven't had a cardiac evaluation yet, you should get one and just kind of get that baseline assessment done to see if there's any signs or symptoms of this so far. At that point, oftentimes it is then up to the cardiology team for how they would follow that long term, what intervals they would want those patients to be checked at. And then obviously if they do find something, then that has to be addressed and managed at that point.